If you are told what is a dose of a drug, what does it mean? Please, can one person answer this question? Can one person answer this question? Okay. Bless is asking question. Answer not fine. Good. I ask. Good. Come for her. So you're telling me quantity. But so if you pack paracetamol, if you get 5 grams of paracetamol and keep here, is that the dose of paracetamol? No. If you get 10 grams of paracetamol and keep, is that the dose? No. Before any drug is pushed into the market, I mean, I'm not talking about, of course, you know what drug, you know that drug is not the same thing with what medicine. I'm talking about drug itself. Before a drug is approved or before it is, you say that this drug now can now be used in formulation of what medicines. During the trials, they check through the pharmacokinetic profiles. They know the dose. We have what is called the leather dose, therapeutic dose, sub-therapeutic what dose. The dose that can cause issues. That's what we call what leather what dose or toxic dose. And we have the dose that can be that is used for what that will be okay for what treatment or for a particular what the disease. Then we have the one that is sub-therapeutic that will not even do anything. Am I communicating? So that therapeutic dose now is established before the drug, during the drug work discovery and the trials and before finally they say, okay, the reason you see they say they take this paracetamol for an adult from 1,000 milligram or 1 gram 3 times daily. It has already been what established. Am I communicating? Yes. It has already been established. Now, if you say a dose of a drug, it talks about what? It's not just quantity alone. Quantity is just an amount. Am I communicating? If you just say quantity, it's just an amount. But when you talk about the dose, is that amount or that quantity that is required for a particular therapeutic purpose at a particular time. So if you get, as an adult, if you get 2 tablets or 1 gram of paracetamol or 1,000 milligram of paracetamol and take now, like that, in the morning, when I was coming out, I was feeling headache. I just took 2 tablets of paracetamol. At that point in time, that 1 gram I took at that point is the dose of paracetamol for me as an adult. That dose. So in a day, you take for treatment of headache, in a day you need 3 doses of what? Paracetamol. While for an adult, a dose is what? 1 gram. So that 3 doses is what? 3 gram in a day. 1 gram in the morning, 1 gram in the afternoon, and 1 gram in the what? Evening. So a dose is what? The amount required for a particular therapeutic outcome or use outcome better at a specific time. Am I communicating? So that's what a dose of a drug is all about. It's not just amount. So don't just say amount. If you say amount, you fail it. It's wrong, because 1 gram is amount. Is an amount. 20 gram is what? An amount. Now 10 gram of paracetamol is also what? An amount, but that one is leather. If it enter your system, I'm sorry for you. Am I communicating? Yes. I'm sorry for you. Sorry is your name. So that one is what? Leather. Is what? Is leather. This thing has been established when they were establishing the pharmacokinetic profile of what? Paracetamol. That's why you don't just, because you are feeling headache, you take 1 gram, it's not working. You take 2 grams, it's not working. You take 3 grams, it's not working. No. Switch to another what? Drug that will help you in your headache. Am I communicating? Then if you continue that, go and look for the underlying issues. There may be, because headache is nothing but what? A symptom. Headache is just a symptom indicating that something is going on somewhere. If you stress yourself too much or cry too much, you may have headache. Two of us. That headache is a sign that you pass through stress. It could be physical stress, it could be emotional stress. Maybe if they break your heart, you start thinking, you have headache. Emotional stress can cause you what? Headache. Is that what I go to school? Am I communicating? Now, if you have such headache now, you don't have to be told, Mama, Papa, Nne, he or she has what? Moved on. Go and sleep. Go and rest. Remove your mind from whatever you think you shared in the past and move on. And once you position your mind in that direction, that headache will start doing what? Going down until you forget about what happened between two of you, and the headache will do what? Disappear. You are taking care of what caused the what? Headache. It may be malaria. If you have clinical malaria, headache is also there. If you like, drink paracetamol from now till eternity, the headache will not go. If you drink, it will come down until you go and treat what? Malaria. If you are hypertensive, when you start having a crisis, headache will do what? Increase until you go and take your BP. Maybe your BP is high, you manage yourself, and the headache will do what? Come down. So am I communicating? Now, that dose at that point in time that help you to achieve this is what? That amount at that point in time, based on the profile of the drug that help you to achieve that without causing other issues in the system, is the dose of the what? The drug. If you take a higher dose, it may take care of the what? The headache, but it will lead to other what? Things in the what? System. Because as the dose you take increases, as the amount you take increases, the side effect of that drug is also what? Increasing. Because you are increasing the amount of the what? Drug. Does it make sense? So if they call you one day now to ask you what is a dose of drug, I believe you know what to say. Good. Okay, so this dose you can have it as what? Single dose. There are some drugs that come as what? Single what? Dose. You just take them once. That's all. Am I communicating? Am I communicating? Yeah. There are some drugs that come as what? Single dose. Amala. So someone said that. What is Amala? What is Amala? Now. Okay, say it here. What is the inside Amala? Is it Amala? Anyone? What is inside? So for what? So for what? What is inside Amala? You don't know. Placebo. Okay, now. Eba. So nobody knows. What's in what? What is active ingredient? What are active ingredients in this malaria drug? In this malaria medicine, what are the drugs? What are the drugs in this malaria medicine? As you know, tell us. Who save us now? Save us, Kedafia, Ijoma, save us. Our researcher, yeah, tell us. Say it again. Let me hear you. You say what? No, Bolia. Kurobuin, okay now. So was it our words? In the words? God bless you. Sulfur doxane plus what? Sulfur plus what? Perimetamine. These are the active ingredients in what? Amala. These are the active ingredients in what? Amala. What are what are the strength there? What is strength of perimetamine there? What is strength of sulfur in there? I will take it how many tablets? Once. 3 tablets at once. That's all. That's all. Okay? That's what happened in single what dose. Am I communicating? There are some treatment even in treatment using injection. There are some you just give. There's some things. So this is what to treat. You just use something like ceftriaxone 1 gram injection once. You stop. Maybe you want to treat for the woman. You can just take some antibiotic like mebendazole. You can also take mebendazole twice daily for 3 days. Yes, but you can also take it 500 milligram at once. But things like albendazole, you take like 400 milligram for once from 2 years up, 400 milligram at once. Am I communicating? That's what we mean by what? One by single what dose. Am I communicating? In the prescription, you see things like IM ceftriaxone 1 gram starts. Am I communicating? You take it what once and ends it here. Tablets albendazole 400 milligram. Just take it. You end the what treatment. You are not taking any other one again. I'm not communicating unless maybe in the near future you start seeing the symptom again or signs again. You may take another one, but at that point in time, and also there are some situations whereby the prescriber may tell you to repeat the course, repeat again maybe after 2 weeks, after 1 week. But the most important thing is that you take it what at once. That's what you mean by what single what dose. Are we together? Yes. Now, then we have what we have daily dose. Daily dose. This daily dose can run a course of 3 days or up to 1 week or 5 days, depending on the duration of the treatment. But that one you are taking it. There are in that daily dose. There are some you take single. You take singly just once a day for like 2 days, for like 5 days, depending on the duration of the treatment. Even though it's single, but you are not stopping. You are continuing for like 5 days. Am I completing? So under daily dose, you have single daily dose. We also have divided daily dose. We have single under. I mentioned single dose before. Then next one is daily dose. Under this daily dose, we have single daily dose, and we have divided daily dose. There are some drugs that some of the antihypertensives like amlodipine. They will tell you take it 10 milligram or 5 milligram depending once a day. Am I communicating? Once daily for like depending 28 days, 30 days, depending on what the duration of the treatment. If you need the physician want you to come in 2 weeks time, you take to take it for 2 weeks, then come back again for checkup. But the point I'm making there is that you take it what once daily for like 2 weeks. You see things like this in the prescription. You see things like this tablets amlodipine, for example, now 10 milligram OD altogether, maybe 2 over what 52. Am I communicating? Tablet amlodipine 10 milligram OD 2 over what 52. This means you take it once what daily. Am I communicating? But for what? You see the difference between single daily dose and just single what dose. This one you take it and do what? Stop. But you take it over a duration of what? Time. Am I communicating? You also see things like drug for treatment of management of what? Hypercholesterolemia, hyperlipidemia, things like you see something like atorvastatin, things like atorvastatin, lovastatin. You see them be taken once what daily for like maybe 2 weeks or 1 month, depending on what the duration of what treatment. So this is what we mean by what single daily what dose. It's a daily dose, but it's what single. Then what one that is what divided. Like that mebendazole, that divided can be twice in a day, can be 3 times in a day, it can be 4 times in a day, depending. Am I communicating? Then it divided dose. Now I made mention of what mebendazole for warm for graphia, treatment of what hermetic what infestations. You see things like you see that mebendazole. You can see it taking like this tablet mebendazole. You can see it at 500 milligram. You can see it at 500 milligram. Start once. But there are some brands that you see that you take it tablets mebendazole 100 watts milligram watts BD 2/7 tablet mebendazole 100 milligram twice what daily 12 hours. Okay, please note this point, please. If you are dealing with drugs that don't attack any causative agent, any infection, am I competing? Any causative agent like pathogens, you may just simply take it morning and what night, no problem. But when you are dealing with drugs like antibiotics, like antiviral drugs, and the drug that attack organism, to avoid resistance, try to maintain specific time. When you see BD, don't just say take it morning and evening. Try to help the patient to see if you can arrive at a particular time. Give 12 hours what interval. BD means twice a day, so you divide it 24 hours a day into 2. So you take it 12 hourly. Am I communicating? Things like ciprofloxacin. You don't just say morning and evening. We know it's 500 milligram BD. We know, but it's better taking tablets flozasine 500 milligram 12 hourly times what 5/7 depending. Am I computing 12 what hourly times what 5/7? We know that this 12 hourly still means what BD. Are we together? But this timing is very important. Remember what I told you about MIC, minimum what inhibitory what concentration, so it can maintain and keep attacking the organism, so it doesn't develop what resistance. Am I communicating? So if you take it anyhow, you see anyhow. It go to a point, if you now take that particular antibiotic, it won't do anything. Am I communicating? Because what you are fighting has developed what you have abused it, and what you are fighting has developed what resistant. That's why some of you after taking artemether lumefantrine for malaria, after 2 days or even 1 week, it will come back again. Because maybe you didn't even take it. Maybe what you should have taken. Of course, you know that when it comes to artemether lumefantrine for the adult dose, the one that comes in 6 tablets in a card, that is 80 watts, 4 watts, 80, something like that. Now, the first dose, if you take the first dose, if you take the first dose, you give 8 hours and take the what? The second dose. Take the fourth dose, the first dose, give 8 hours. Some they will tell you just take the first dose, give 8 hours. The following day, you not take it morning and night. Sometimes it doesn't work like that. Yes. Do you know why I say so? It depends on when you started taking the medication. Let's assume now you started taking it in the morning, say 8 a.m. in the morning. You can take one tablet 8 a.m. in the morning. Give 8 hours. From 8 a.m., 8 hours is 4 p.m., right? Yeah. You take the 4 p.m. Wonderful. That's when it will work for you. If you take 4 p.m. in the morning, you now take 8 a.m. in the morning and take 8 p.m. in the evening. Wonderful. But what if before you realize that your issue is malaria, maybe it will be around 8 p.m. So how will you do it? If you take that first dose 8 p.m., then give 8 hours, take 8 a.m. You now wait again in the morning, is wrong. You are confused about what? You don't know what is 8 hours. So why are you confused? So we are confused. Hello, let him ask his question. Ada, be coming now. Ask. You are going to explain 8 hour interval. So my question comes from the lab definition, like lab. Okay, artemether lumefantrine. Go sit down. I said if you get a packet of artemether lumefantrine, you will see where you see something like, or even when you are being cancelled in some places, you see things like take the first dose, give 8 hours before you take the second dose. Then the next day, start taking it morning and evening until it finishes. And I'll say that works if you started it in the morning, the first dose in the morning. Let's assume you started taking the first dose by 8 a.m. or 10 a.m. in the morning. Now you take it 8 a.m. in the morning. You give 8 hours. The second dose will be by 4 p.m. right? Then after that 4 p.m. the next day now you will now start in the morning again. That's where it will work. And I ask, what if the person has been taking paracetamol until they later realize that the person's problem is malaria by 10 p.m. or 8 p.m. in the evening? He will now go and buy the artemether lumefantrine, and the person takes the first dose by 8 p.m. and gives 8 hours. 8 p.m. 8 p.m. give 8 hours is 4 a.m. Yes. Then after 4 a.m. the person will now wait till the next day. That is the point I'm making. It should be time specific. Am I communicating? Now, let's assume now, if you take the first dose 8 a.m., take the second dose after 8 hours, which is 4 p.m. Then the next dose, the third dose, should be 8 a.m. in the morning. That same time you started the first dose. You now start taking it 8 a.m., 8 p.m., 8 a.m., 8 p.m. until it finishes. Am I communicating? So in a nutshell, you can say if you take the first dose by 8 a.m., give 8 hours, take the second dose by 4 p.m. The third dose should be, if you take 4 p.m. to 8 a.m. in the morning, how many hours difference? 4 p.m. in the evening to 8 a.m. in the morning, how many hours? It should be 16 hours. 16 hours, right? So the first dose, if you take the first dose and give 8 hours, take the second dose. The third dose should be 16 hours from the second dose. I'm not communicating. Then after that 16 hours now, you now start taking it 12 hours. 12 hours until what finishes. So let's assume you start something like this. Which drug are we talking about? Which drug are we talking about? Good. So this is first dose, right? First dose, right? After 8 hours, are we together? You take the what? Second dose. Then after taking the second dose, you give what? So you give what? 16 hours and take the what? Third dose. After the third dose, how many hours you give? You give 12 hours to take the what? Fourth dose. Then after the fourth dose, you give what? After the fourth dose, you give what? Another 12 hours, okay? To take the what? The fifth what? Dose. Then give another what? 12 hours to do what? Take the what? Sixth what? Dose. Now this is number of hours you should give. Now let's now fix any particular time. Let's now fix any particular time you from depending on when you started the first dose. Let's assume you started the first dose 8 a.m. today. That means here is 8 a.m. right? Yes. The timing can change, but the number of hours is what? Fixed. That's what I'm making. 8 a.m. The next one, if you take 8 a.m., add 8 hours to 8 a.m. is what? 4 what? p.m. The next day, if you add 16 hours to here, it becomes what? 8 a.m. the next day, right? 8 a.m. Then add 12 hours to this 8 a.m. It becomes what? 8 what? Add 12 hours to 8 a.m. 8 p.m. Good. No, only one person is speaking. That's why I want to find out why others kept quiet. Is it that they didn't understand what you are doing or what? So here is what? 8 what? p.m. Of course, you know that this is the first day, right? And this is the what? Second day. True of us. 8 a.m. second day. If you add 12 hours, 8 p.m. 8 p.m. Now, if you enter here now, if you add another 12 hours here, here is what? 8 what? a.m. right? Then I add another 12 hours here, becomes what? 8 p.m. So the first day, 8 a.m. and 4 p.m. First day. Second day, 8 a.m. and what? 8 p.m. Third day is what? 8 a.m. and 8 p.m. Am I communicating? Good. What if you started what if in the night? What if as I said before now, they discover that the what the person is suffering from is what? Malaria, and they rushed to one pharmacy, and the pharmacist, having looked at the patient or whatever happened, and give stand up. Stand up. Sharp there. Stand up. And they now realize that's very, and they now, give, and they now dispense the lumefantrine by 8 p.m. And maybe before getting home, the person would now start taking it by 9 p.m. Now here it comes what? 9 p.m. on the first day, right? So the second dose will now be when? When? 5 a.m. in the morning, right? 5 what? a.m. Then the third dose will be when? Add 16 hours to this. 9 what? 9 p.m. 9 p.m. Is it 9 p.m.? 9 p.m. because 5 p.m. 5 a.m. to 5 p.m. is 12 hours, right? Add extra 4 hours, it becomes what? Good, 9 p.m. Here is what? 9 p.m. Then 12 hours again, here becomes what? 9 what? A.m. 12 hours again, 9 p.m. 12 hours again, 9 a.m. So the person took the first dose 9 p.m. that night. The following morning, second dose by what? 5 a.m. That same day, third dose by 9 p.m. that same day. The next dose 9 a.m. the following day. 9 p.m. then 9 a.m. the following day. Am I completing? So this is how it should be dosed. This is the right thing to be done. But you know now, maybe because some people maybe the fear of maybe not keeping to it, they just tell you first dose, take it what 8 a.m. Take it, give 8 hours. First dose, second dose, then in the morning and evening, be taking it like that in the morning and in the morning and evening. If you go and try a lot and it work, maybe your immune system is still strong, it works out, bravo. But sometimes you take it again. Sometimes even in the midst of that, you have morning and evening. Some people will not even take it. So we just take one and go. Maybe after the first day, they will pack the remaining one and push under their bed and forget about it. After 1 week, you come back again. Has it ever happened to you before? Confess. But I know those that fall sick in this class. I know them well now. I know them. I know those that go to pharmacy all the time for drugs. I know them. I don't to call their names, so I know them. Maybe they take one dose, first dose, second dose, and they feel that they're okay now. They will pass only one and throw away. After 5 days, it come back again. So please, this is because you have not taken care of the causative what agents. These things have been established. The dose in the system that will tackle them. So if you mess it up, they just looking at you. You know that this drug is like a bomb. If you throw it hit them. You throw, if you hit them. If you get tired of throwing, they'll come back again and continue the fight until they deal with their immune system and you become well down. They don't start dealing with you. So please start from yourself. Don't miss your doses before you go to patient to talk to. Start from yourself. It's low. Okay. Start from yourself before you look for a patient to talk to. Am I communicating? Before you look for a patient to talk to, you say, please take your drug. Take it twice. Make sure you take this drug. If you go so you won't take your own. Don't be like that. Okay? Do not be like that. They say, to your bumbo. But if you come close to them with needle injection. But if you see where they spark patient, don't be like that. If it's your own time to be injected, majestically present your bonbon for injection quietly, because you should be an ambassador of compliance towards medications. Am I communicating? You should be ambassador of what? Compliance to what? Compliance and adherence to what? Medication. Preach. Practice what you do what? Preach. Don't worry. I'll target you down. We'll start working. I'll come there. If I see you cancel, I say, don't mind this human being. You're not serious. You don't think it's a drug. Okay.
So we also have weekly doses. There's some drug that comes as what? Weekly. You take your what? Weekly. Are we together? Yes. Some anti-malaria like mefloquine is taken what weekly. Mefloquine. Mefloquine is taken weekly, 250 milligram weekly. So that means if you take, let's say today is what? Monday, right? Yeah. And the time is what?
10:24.
10 what? 10 what? 10 what?
10:24
a.m. Let's assume now you are taking what? Mefloquine. So that means every Monday at this time, am I computing?
Yes.
Something like that. 10, 20, 10:30, 10 20 something in the morning. Every Monday. That's what we mean by what? Weekly. Weekly what? 250 milligram weekly. So you see something like this, tablets, mefloquine, 250 milligram. Sorry, so like these tablets, mefloquine, 250 milligram. OD. Let's assume you. Sorry. Weekly, are we together? Are we together? Maybe, depending, 4 over what? 2. Are we together? Something like this. In your first year, did I break down prescription for you where you have the strength? Dosage, listen first. The dosage form, the drug nomenclature, the strengths or the dose as case may be, the frequency of administration, and the duration of what treatments.
No.
Did we?
No.
Did I mention things like this?
No.
I know some will always shout no by default. Some people have been programmed to say no by default. So after saying no, they will now realize what the question that was asked. Can we? No. That's the factory setting. No. At the end, they will now realize that what they were saying no was actually what? Yes.